The former head of Ontario's COVID-19 science table says it's time to bring back some mask mandates. Dr. Fahad Razak says in August and September, the health system was under the kind of strain that's normally seen at the peak of a bad flu season, and that there's little capacity to respond to an increase in COVID-19 cases. For more on this, I'm joined by Dr. Razak, the former head of Ontario's science table and internal medicine physician at St. Mike's Hospital. Dr. Razak, thanks again for joining us tonight.
Good to be back.
What is most concerning in the metrics you're seeing that are prompting your call for return to some mask mandates? Are you more concerned about what's in store for the future or what you're seeing right now in hospitals?
It's a combination of those two. So if you look at where we are in the system, people have read stories, hundreds and hundreds of stories the last couple of months about strain. That ranges from emergency rooms closing, to the wait times, to surgeries again being deferred, or to the challenges in our kids' hospitals the last couple of weeks that we've seen with respiratory viruses. This is an unprecedented amount of strain considering how early into the respiratory virus season we are. Typically, these things peak much later, December, January, February. We simply don't have the kind of reserve in the health system that we did entering the pandemic. The health system's been asked to respond wave after wave after wave, and you're seeing that in the burnout, in the lack of coverage, and the gaps that are occurring. So the reason that I think it's the right time to start mask mandates now is we have very few options, truthfully. The problems with capacity, with beds, with staffing, those are going to take years to address, and they're not the fault of any one government. They've occurred over the last couple of decades, but we need to get through this winter, and there's very few options available now. So I think using masks in essential settings where you cannot avoid being there, transit, grocery stores, healthcare settings, to me, is part of a start strategy that also encourages vaccination because we don't have a lot of other alternatives.
And also, to add to all of this, how will flu season play into what's going to happen over the next several months in hospital?
It's part of the story. This is not just about COVID, and I want to emphasize that. So influenza has typically stressed our system and has caused massive problems even before the pandemic. For example, some of the longest wait times I've ever seen, or some of the worst capacity issues I've seen, was actually the winter before the pandemic started because of a bad influenza season. At the same time, you're seeing the challenges now with RSV and other viral illnesses in children. And the strategy that you use to control something like COVID, using masks, improving air quality, those benefit us in multiple ways by reducing these other viruses as well. I can say personally, as someone who cares for influenza patients when they're admitted to hospital, the last couple of years, I've seen 0 cases personally of influenza. And now, again, I'm starting to see cases. So this is part of a strategy to keep our system running, reduce influenza, reduce COVID, reduce RSV and other viral illnesses. It's all part of one strategy.
And at this point, what's your level of concern with the rising number of COVID-19 deaths and uptick of cases we're seeing over the past few weeks? This week, the province recorded 121 COVID-19 deaths, the highest number of deaths reported over a one-week period since back in the spring.
It's clearly telling us that the pandemic is not over. So we are facing challenges with COVID-19. We are not seeing ICUs filled with people. I was part of the frontline physician teams that had to deal with that early in the pandemic. We're not seeing the COVID pneumonias, but COVID is affecting people and people are getting very sick in other ways. It's often tipping over other chronic illness they have, whether it's heart failure or COPD, or it's causing people to become very sick in other ways that is leading to these death rates. And so I do think we need to take those numbers seriously. Clearly, we're not experiencing the ICU levels of stress we had before, but you can see people are dying and you can see stress in other ways. And that's why I think it's important to think about a holistic strategy at this point.
And Dr. Razak, what about these new Omicron variants? Health officials are now keeping an eye on the BQ1 and BQ11. What can you tell us about these?
These are part of the Omicron family of variants that continues to circulate throughout the system. So the surge that we experienced at the end of the summer and into fall was driven by BA5. BQ, BX, these are additional Omicron variants which seem to be out-competing BA5. They have a greater ability to spread than BA5, and they're displacing BA5 in terms of prevalence in the province right now. Now, look, it's early days. There's nothing to suggest, for example, that they are more severe or more vaccine evasive. That data will come, and they very well may be, but it just reflects the fact that with this enormous amount of viral transmission that's happening, many tens of thousands of cases a day, new cases a day are occurring right now in Ontario, there is an opportunity for these kind of variants to continue to propagate. Now, that's not just a Canadian problem, that's an international problem, but it does tell us that we are far from over in terms of managing this pandemic.
Dr. Fahad Razak, the former head of Ontario's Science Table and internal medicine physician at St. Mike's Hospital. Always appreciate your insight. Thanks so much.
Yeah, nice to be back.
Appreciate it.